Hello, fellow Rotarians and guests. I'm Lori Alton, and I'm honored to serve as your club president for the Rotary year 2021-2022. The Rotary Club of Columbus has a storied past, beginning in 1915, when a group of civic-minded people saw the need for leaders to come together to find ways to make our community better. And now, 106 years later, we're a vibrant, strong club that continues to place service above self. Our club is diverse, with members across all sectors of business, government, military, healthcare, education, nonprofit and community service, ministry, and the arts. And we come together each week as friends with a shared purpose of learning how we can be more involved in the things that matter to all of us. And we leave committed to changing our community and changing lives. As Rotarians, we are people of action, and it shows. The COVID-19 pandemic this past year has presented unique challenges to both our community and our club. However, as Rotarians and as friends, we've been steadfast in our commitment to our club, to one another, and to our fellow citizens. I've seen you reach out to others in need. You've stepped in to serve where there were gaps, and you've demonstrated love and compassion for others. But I'm not at all surprised, because that's what Rotarians do. This year, we're striving for some sense of normalcy in our lives, with our families, and in our club. We can once again gather together each week for lunch and fellowship, and I, for one, could not be more grateful. There are exciting things happening in your Rotary Club, and I'm glad you're part of it. As a service organization, the projects we're planning have a real-time impact on people's lives. So welcome back to Rotary. Thank you for being here, and thank you for making a difference in our community. Well, hello, and welcome to the July 21st, 2021 meeting of the Rotary Club of Columbus. It's so great to see all of you here, and a special welcome to all of you who are joining us virtually. As I mentioned last week, every week this year, I would like to highlight one of our Rotarians who is doing something wonderful in our community. And I appreciate all of you who have sent me examples of Rotarians doing great things. Please keep sending them. And this week, though, I would like to recognize our very own Jamie Hempstead. Jamie, wave to us. Longtime Rotarian who is serving our club behind the camera. Without Jamie, we would not have our video each week. So Jamie, thank you for your service above self. We appreciate you. And now would you please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now I would like to ask past President Michael Silverstein to bring us our invocation in accordance with his faith tradition.
Pray with me. Heavenly Father, we have come together as Rotarians and as your congregation. We thank you for all the blessings that you bestow upon us each and every day, and we thank you for the opportunity to fellowship with one another. We are so thankful to be a part of an organization that embodies service above self. We ask for your blessings for our country, for our city, for its leaders and advisors, and for all who exercise just and rightful authority. May this land, under your providence, be an influence for good throughout the world, uniting all people in peace and freedom. May citizens of all races and creeds form a common bond in true harmony to banish all hatred and bigotry, and to safeguard the ideals and free institutions that are the pride and glory of our country. We ask that you watch over the fine men and women that serve in our military, they and their families. We thank you for the food we are about to partake, and it is in your holy name we pray. Amen. And please don't forget the cans. Thank you.
Thank you. So as you know, the past 2 years, Cameron Bean, this is prior to COVID, Cameron Bean has been bringing us our top news stories. Well, Cameron recently came to me and he said, I think it's time to pass the torch. And so that left us with such big shoes to fill, we had to actually recruit 2 Rotarians to co-anchor the news. But first of all, would you please join me in thanking Cam for his wonderful and entertaining news stories? So now it's my pleasure to announce the new dynamic duo news anchors, Cedric Hill II and Alston Lyle. So today I would like to ask Alston Lyle to bring us today's top stories.
Hi everyone, here's a look at your headlines. CDC officials reported a 69.3% increase in COVID cases as compared to last week's moving average. The 7-day average for hospitalizations increased as well, growing 36% from the previous 7-day period. More than 97% of hospitalizations are among those that are unvaccinated, and most new cases are reported of those of the Delta variant. Now, the global rise of COVID cases has affected a handful of athletes in the Olympic Village. However, while Japanese citizens and physicians express concern over the growing COVID cases in Japan, organizers have no intention of postponing any further, with the Olympics opening ceremony slated for Friday, July 23rd. Over 11,500 athletes, 9 overseas officials, journalists, and support staff have arrived in Tokyo ahead of the Games. Now, in sports, last night the Milwaukee Bucks claimed the NBA championship with a 105-98 win over the Phoenix Suns in Game 6 of the NBA Finals. Milwaukee was spurred on by a historic 50 points from Finals MVP Antetokounmpo. The win brought the franchise their first NBA championship since 1971, which was led by Oscar Robertson and Kareem Abdul-Jabbar. Looking at our local news, fellow Rotarian Superior Court Judge Bill Roomer has announced his retirement. Judge Roomer served on the bench for over 11 years, with many years in private practice prior. The Chattahoochee Circuit and Columbus legal community will surely miss him as he heads into retirement, but I am confident, I speak for all here, that we wish him and Becky the best in this next chapter. The stock market experienced a steep drop Monday, with the Dow falling roughly 725 points, the S&P 500 down 1.6%, and the NASDAQ down 1.1%. which accounted for the worst day since a 943-point drop in late October of last year. Investors seem to be spooked by the rise in COVID cases and fear that the Delta variant could affect the U.S. economy's recovery. That said, the market gained some ground on Tuesday, with the Dow up by over 500 points, and today the Dow is up by 228 points as of noon. Your weather forecast is mostly cloudy with a chance of thunderstorms, with a high of 84 and a low of 73 today. And we want to end with a little piece of trivia. Does anyone know how many Olympians call Columbus, Georgia home? I didn't either until today. There are 2. Thomas Tomas was on the rifle national team in 1992, 2000, 2008, and then Edwin Jackson on this year's baseball team.
Now it's my pleasure to call on President-elect Cedric Hill to introduce today's visitors and guests.
Thank you, President Lori and fellow Rotarians. It's my pleasure today to introduce our guests that are with us today. We'll start realistically up in the front with the guests of our guest speaker today. And we'll start with those guys that, if you would just be so kind as to wave your hand or either stand, either one. We'll start with State Representative Ed Harbison. And then State Senator Ed Harbison, and State Representative Carolyn Hughley, if you would. And then from the West Georgia Cancer Coalition, we have the President, Earl Johnson, and the chair of the board of the West Georgia Cancer Coalition, Mr. Herman Lewis. And then the speaker has with her from her staff, Dr. Cheryl Gabram. Thank you. And she's the Chief Scientific Officer. And she also has Kate Cunningham with her, which is an intern from her office. We also have Ken Townsend with us from GRSP, trustee. To move over to our further group, we have Chris Carlson actually has his daughter Piper. Piper, where are you? Okay, welcome. Jimmy Elder has his son Johnny. Johnny, where are you? Welcome. And Steve Pace. Is Steve still here? Steve said he may have to leave. Steve Pace came to visit with us briefly from Phoenix City. And last but not least, Monique Jackson. Monique Jackson actually is the Chief Safety Officer for our local transportation organization, Metra. If you would, Club, join me in welcoming our visitors and guests today. Thank you so much.
If you'll just hang tight for a second.
Okay.
Welcome to all of our visitors and guests, and we hope that you will come back very soon to see us. And so I was asking President-elect Cedric to stick around because we have a new member introduction, and he is going to do the honors. And so while they're walking up to the microphone, we just share with you, we do not have a Soldier of the Week visiting with us this week, and hope to have that back in the rotation next week. So, Cedric, would you please introduce our newest Rotarian?
Promise you I'm not the program today. It does give me great pleasure also to welcome our chamber president, Gerald Mitchell, to our club also. Gerald is actually was born and raised in the Savannah, Georgia area. He came to us by way of Atlanta, and he was working on the Atlanta Beltline project. So many of y'all may be familiar with that project itself. So we're really happy to have both Gerald and his wife Stephanie in the Columbus area, and he's been here a little less than a year now. So his background is economic development, so we're looking forward to Gerald jumping into our club, being a part of this club, and of course us being able to embrace him and what he's doing in the community. So if you'd be so kind as to join me in welcoming Gerald Mitchell to our club. Gerald, I'll officially give you your Rotary pin and your Rotary packet, and I'll yield the microphone if you'd like to have words.
I yield back. No, good afternoon. I'm Gerald Mitchell again. Thank you so much for welcoming me. My wife and I have had nothing but a fantastic experience in Columbus, and I am so fortunate to be a part of a fantastic organization that is the Greater Columbus Chamber of Commerce. I look forward to working with each of you. I know so many people in this room, and I feel really surprised by that. But again, thank you all so much for your current support, and I look forward to ongoing support and partnership with each of you. Thank you so much.
Gerald, we are so excited to have you and Stephanie in the Columbus community. We're also excited to have you as part of the club. As you may or may not know, the Rotary Club of Columbus is club number 200 out of 35,000 clubs around the world. And we have a 106-year history of doing a lot of service work in the community. And so we're definitely excited about working alongside you. Thank you. Several announcements that I would like to share with you. First of all, it's with great sadness that I announced that our former Rotarian, Jackie Lowe, passed away on Sunday after a brief illness. As many of you know, Jackie was a force for good in our community, and I remember coming here, over 20 years ago, and Jackie being one of the first people I met, and working with her all these years when she was at Georgia Power and at the Chamber, and so she will certainly be missed, and so please keep her family in your thoughts and prayers. And then also, if you are not yet attending in person, but you would like to attend, if you would simply RSVP by Friday of the week before, we'll put your name on the list, and we would love to have you back. If you're on the standing RSVP list, all you need to do is let us know if you can't come. So today at the head table, we have Michael Silverstein, past president, who brought us our invocation. And now I'd like to ask past president Tyler Townsend to please introduce our speaker.
Thank you, President Lori. It's my privilege to introduce today's speaker. Lynn Durham is president and CEO of the Georgia Center for Oncology Research and Education, also known as Georgia CORE. This is a state-supported nonprofit with the mission of advancing cancer care throughout our state. And as a cancer survivor herself, Lynn began volunteering with Georgia CORE as a member of the Survivorship Advisory Board and then on the board of directors until she was hired as CEO earlier this year. And prior to that, Lynn served as Associate Vice President and Chief of Staff to former Georgia Tech President Bud Peterson, and later as Vice President for Tech's Institute Relations, where she oversaw federal, state, and local government and community relations, as well as economic development interactions with state and local governments. Lynn has a Doctor of Education degree from the University of Georgia, a master's degree in public administration from Kennesaw State University, and a bachelor's degree from Radford University in Virginia. And a graduate of the 2013 class of Leadership Georgia, Dr. Durham serves on the nominating committee for the Ivan Allen Jr. Prize for Social Courage and the Georgia Women of Achievement Award. She also has leadership positions with the Georgia Cancer Control Consortium, the Georgia Society of Clinical Oncology, and the Georgia NCI Community Oncology Research Program. So please join me in welcoming Dr. Lynn Durham.
Thank you so much, and thank you, Tyler. What Tyler didn't tell you is that he and Eleanor have been such great friends of mine since 2013 when we went through Leadership Georgia together, which was an incredible honor. Also, Herman Lewis here and Gerald Mitchell. We were all classmates of 2013, so this is particularly wonderful to be here today, so thank you so much. And I was a Rotarian for many years in East Cobb, and I'm not currently a Rotarian, but I know the great work you do. So I thank you so much for all you give to your community and to the state, because Rotary really matters, and it's a wonderful, wonderful organization. I will add just one last thing from Tyler's introduction. I'm actually a 3-time cancer survivor. I've had thyroid, breast, and chronic myeloid leukemia, which I am in remission right now. And I say that just to say I would not be standing here today if it weren't for clinical trials. And I'm going to talk to you today about the great work in Georgia that is happening in clinical trials and other areas of cancer that this state is supporting. And so I am very grateful for that. So what is Georgia CORE? Start there. Georgia CORE, as Tyler said, the Center for Oncology Research and Education. We work throughout the state. We're a statewide organization, and we bring partnerships together to bring innovation to cancer care across our state. We promote clinical trials, increase research through our research universities in the state, and promote education to improve cancer care in Georgia. We started back in 2003. Several of you will hear the name Hamilton Jordan. You'll remember Hamilton Jordan. He was the chief of staff to Jimmy Carter, President Jimmy Carter. He was from Albany, and he had cancer 4 times, actually succumbed to his final cancer in his 60s. But his dream was that Georgians would not have to leave our state for the best cancer care in the world. That's what he wanted. So he worked with Governor Roy Barnes at the time, and they set up what was called the Georgia Cancer Coalition, and out of that came Georgia CORE. And our role at that time was really to increase the number of clinical trials in our state. So clinical trials are research studies, drug studies, other ways to find how we can better treat cancer and prevent cancer. And so there are many clinical trials. We have over 700 in our state going on right now. But the more clinical trials you have, the better cancer outcomes you have. And so it was really important that we started this organization 18 years ago to do that. In just under 2 decades, Georgia CORE has been working to bring new clinical trials and scientific discoveries from Georgia, and then improving access to our communities, especially with disparities in healthcare between our different ethnic communities and racial communities, improve quality of life for our patients and survivors. Georgia has over 450,000 cancer survivors, and they have needs. When you hear the words, you have cancer, you have different needs after that. And so we work with our survivor communities, and we're working to decrease the cancer rate of mortality. Just to level set here so we all know the same numbers, cancer is the second state leading cause of death and contributing to 21% of all deaths in Georgia in 2019. We expect about 18,000 deaths, unfortunately, this year in Georgia from cancer. And we know that many people have not gotten the screenings they need for early detection because of COVID. So one of my messages today is to please get your screenings if you have not, if you are in the age group or have the background that, such as being a smoker or other areas, to get your screenings. And I'll talk about that some more. Cancers with the most incidence in our state are breast, cervical, lung, colorectal, and prostate. So those are the 5 top cancers in our state. Unfortunately, melanoma is also making an increase, skin cancer. So we always want you to wear your sunscreen as well. And then to date, Georgia CORE's promotion and facilitation of cancer trials, as mentioned a minute ago, over 700 clinical trials in our state. We are built on partnerships. We by no means do this alone, and I am so happy to have Cheryl Johnson and Herman Lewis here today from the West Central Georgia Cancer Coalition. They are one of our partners around the state. We also partner with the healthcare centers. John B. Amos Cancer Center here in Columbus is one of our partners, as well as the Georgia Cancer Control Consortium. So first, let me talk about that Cheryl. You met her just a few minutes ago. So what they do, they are the boots on the ground. They are the ones working directly with patients. They're trying to provide screenings. They're raising money. They're providing access to care and treatment. They're working with the community, and they are well known here in Columbus, and we are so grateful for all the work they do in this area. And then next is the Cancer Control Consortium. So this is a group from around the state, about 80 partners or so from around the state, and we work together. We have monthly phone calls to talk about cancer control and prevention in our state. And so this group gets together and we make a 5-year plan with the Department of Public Health each year to set what are our priorities in cancer for this 5-year period. Right now, in the period we're in, we're supporting cancer prevention with a focus on HPV prevention. So HPV is the human papillomavirus. If your teenager or grandchild who's a teenager has not gotten that vaccination, I implore you to please have them vaccinated. This will prevent cervical cancers and certain head and neck cancers that are caused by this virus. And so that is a big push that we are making. We want to detect cancers early and screen for the most prevalent cancers. So those 5 prevalent cancers I mentioned can all be screened for. And so we want to make sure people are screened. We want to maintain the excellence in diagnosis and treatment of cancers. So when the Georgia the Georgia Cancer Coalition was formed back in 2001, one of its aims was to bring the best cancer scholars and physicians to Georgia, again, to make sure no one had to leave this state. And so we want to continue that and make sure that we have in communities throughout the state, not just Atlanta, communities throughout the state, the best physicians and cancer researchers, so we are contributing to knowledge about cancer. We want to facilitate statewide access to palliative care. Palliative care is that care once you've been diagnosed with a life-threatening illness. And there's certain types of care that's a more holistic type of care, and so we want to make sure that that is provided. And we want to improve the quality of life for the 450,000 cancer survivors that I mentioned. They came out with this program, or this pamphlet called 5 Actions to Save More Lives. And so again, quickly, we want to screen more Georgians for colorectal cancer. If colorectal cancer is found early, it's very treatable. If you are in the age range of 45 to 75, please talk to your doctor about a colonoscopy or at least a FIT test. A FIT test is a stool-based test. But please don't let, when it's found early, it is so incredibly treatable. So we want to make sure people do that. We want to help Georgians avoid or beat lung cancer. Lung cancer is very deadly when it's found late. And so if it's found in the 3rd or 4th stages, it can be very deadly. If you can find it early through low-dose CT scans, so if you're a smoker, or you were a smoker, or you live with a smoker, I hope you'll talk to your doctor about going and getting a low-dose CT scan, because if they find it early, they can treat it. We want to address Georgia's disparity with breast cancer. So Black women and white women get breast cancer at about the same rates, but more Black women die because they usually present at a later stage, or they may have more aggressive cancers that are found because of genetics. But more Black women die, and we don't want that to happen. So we wanted to address that disparity. Same for prostate cancer. More Black men die of prostate cancer than white men. We want to address that disparity and make sure that that is not the case. And then we want to reverse Georgia's decline in cervical cancer screenings. So ladies, If you have not been to your gynecologist and gotten your yearly pap smear, please talk to your doctor, and please do that. It's incredibly important. Again, cancer found early is cancer that can be taken care of, and so that's what we want to do. I want to tell you quickly about how we pay for this in the state of Georgia. So back in 1998, many of you will remember that Big Tobacco was sued, and so all those big tobacco companies were sued by states. Georgia is one of those states that sued the Big Tobacco. Our state gets about $166 million a year from Big Tobacco. When we first started getting that money back in 2001, we got 27 cents on every dollar toward cancer-related activities. Now we only get 9 cents on every dollar because of cancer-related activities. Most of that money is going to Medicaid. They're filling that hole because Medicaid is costing a lot of money. We certainly understand that, but what we want to say is we want to move some money toward prevention so we're not having to treat those cancers that are at later stages and put more and more money in the Medicaid bucket. And so our message to legislators and to others is please work with us to put more money on the prevention side so we don't have to treat as many cancers. Whoops, excuse me. There we go. So our core connections here in Columbus, I want to say Dr. Andy Pippis is not able to be here today. He had a family wedding that he needed to attend. But Dr. Andy Pippis is the chair of the board of Georgia CORE, and he has been for several years. He's at the John B. Amos Cancer Center. I know he's in the Columbus area, well respected. We are certainly so proud to have him as the chair of our board, and he has been a wonderful advocate for us throughout the state. And then also, of course, I've already mentioned the West Central Georgia Cancer Coalition. They have been fantastic partners. One I don't have on here that I want to mention is AFLAC. AFLAC, through their philanthropic program, has given Georgia CORE funding. When I talked about that the pamphlet, 5 Actions to Save More Lives, they contributed to the research and the production of that. They have been great supporters of ours, so I do want to thank AFLAC for everything they have done as well. So quickly, clinical trials in Georgia. When I talk about Dr. Pippis and the John B. Amos Cancer Center, he is our primary investigator. He is the physician that works with our clinical trials. So he tries to bring clinical trials that are done through the NCI, the National Cancer Institute. He brings those right here to Columbus. So you all, if God forbid you had cancer, you would not have to go to Atlanta to participate in a clinical trial. And again, clinical trials improve outcomes, may improve outcomes for you as the patient, and hopefully it will, but it will definitely improve outcomes later down the line as people learn more about the cancer and about the treatment and about the pharmaceuticals that can help that. So that's happening right here in Columbus, and that's through what we call the Georgia CORE, and that's the NCI Community Oncology Research Program. They work with Northside Hospital in Atlanta and Savannah, St. Joseph Candler in Atlanta, and then Gainesville, Macon, Rome, and Valdosta. Those are the groups in NCORE. There's another NCORE in our state that focuses on minorities and getting more minorities to participate in clinical trials. We know it's harder to get minorities who have a history of apprehension and problems with clinical trials to participate. And so this is the minority from Augusta University. The NCORE from there works with particularly minority patients to get them involved, and they work with Albany, Athens, the Morehouse School of Medicine, Dalton, and Dublin. And so again, our goal is just to get more Georgians in clinical trials. One other thing I want to let you know about is the great program we have right now. It's called the CDC Colorectal Cancer Screening Grant. So we are working in Southwest and Southeast Georgia right now to increase the percentage of colon cancer screening that's happening there. And so we have a grant, a 5-year grant, $5 million from the Centers for Disease Control, and we're working with the federally qualified health center clinics in those areas in 15 counties, and we're improving the screening rate. We had a county as low as 18% screening rate. The standard, it should be 60%, and that's what we're trying to get to. Of course, we'd love to get to 80%, even higher, but at least we want to get to 60%. If you don't remember another thing I say today, I ask you to remember this. Our website is georgiacancerinfo.org. georgiacancerinfo.org gives tremendous amount of information. If someone you love, someone you know has cancer, please direct them to this site. There are clinical trials listed there. There are doctors. There is incredible amount of information about cancer, but not just about that, but about every aspect of cancer. Financial, the spiritual, the mental, the physical, every aspect of cancer. And so I hope that you will direct people to go to that website and see more. One particular piece of that website is on genetic screening and testing. Ladies, if you have not done a survey just to see if you may have the possibility of hereditary and breast or ovarian disease, then we want you to go to the website. You take a short survey, and then it will tell you if you should think about being screened for this. So it'll ask you some questions, and then if you are asked to be screened, you can do a swab of your cheek and be screened and see if you have hereditary breast or ovarian cancer genetically in your family. Doesn't mean you have the disease. It just means you may be predisposed to that disease. And then survivors' needs, I'll very briefly say that we have these wonderful materials on that website where you can go to learn more about how, as a survivor, you handle and live through and thrive after cancer. I know Cheryl Johnson has many of these pamphlets at the West Central Georgia Cancer Coalition as well. So lastly, breast cancer tag. We were so fortunate. This is Representative Beth Camp. She's from not too far from here, Concord, Georgia. And she was the sponsor for our tag bill. We have a brand new redesign of the breast cancer tag. We've had a tag for a long time. It has the little stamp. It used to have the old breast cancer stamp on it. Many people don't know what it is or what it looks like. Georgia CORE gets $22 from the sale or renewal of every one of those tags. And that money then we give to grantees such as the West Central Georgia Cancer Coalition to go out and give low-cost or no-cost mammograms to women who need it. That has been a great program, but unfortunately the sales have gone down, 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 down. We used to get almost $1 million a year from that program. Now we're down to about $200,000 a year. So we can't give the amount of grants we need to. So luckily, because of our wonderful state legislators who approved this, which we are with, that is a new license tag. It is on sale now. It went on sale July 1. So you can go to your tag. It doesn't have to be your birthday. You don't have to you don't have to wait for your birthday. You can go into your tag office. You can ask to switch to this plate, and we can benefit from that. The other, we have two new plates. The other is an all cancer awareness tag. So many people came to us and said, well, we'd love to support cancer research and cancer screenings, but don't have breast cancer. What about something else? This is an all cancer tag. And so as you see that circle, it has the ribbons, all the different colors of the ribbons of cancer. And so again, $22 of that sale or renewal of every tag will come to us, and that will go to look for screenings for especially colorectal, prostate, and cervical and lung cancer. So that's what we plan to do with that. This was the ad we had in Georgia Trend magazine, and we will continue advertising this. Your vehicle just might save a life, and so we hope you will do that. So I will finish with this slide. What can you do? There are many things you can do. First and foremost, get your screenings. Encourage others to get their screenings. It's incredibly important. We know that COVID's going to bring more late-stage cancers, and that's scary, but it's so much better to know what's going on. So go in there and get your screenings. Buy a cancer awareness tag or a breast cancer tag, which we talked about. I didn't highlight this, but we have a survivorship advocacy council that we work with, and that council is about different forms of advocacy for cancer survivorship. One, of course, is talking to legislators or elected officials, but really one of the main points is how do you advocate for yourself? How do patients advocate for themselves? How do families advocate for their patients? And so we talk about that a lot. If anyone's interested in that, please let me know. We want you to participate in clinical trials. God knows we hope you don't get cancer. We hope none of your family and loved ones do, but it's likely that someone you know will get cancer, and I hope they will consider participating in a clinical trial. It does amazing work and really advances our knowledge of the disease. You can donate to a research fund. I know taxes are over this year, but next year when you're filing your Georgia taxes on line 32, there's a place you can put a dollar amount, any dollar amount you want, $1, $100, $1,000, and it goes to cancer research. Georgia CORE gets those funds, and we work with our state university partners and others to increase the amount of cancer research that we do right here in Georgia. We'd love for you to advocate for more tobacco funds to go toward prevention and toward cancer-related activities. And lastly, Georgia CORE is a 501c3. We always accept donations and are very grateful for any help that we receive. So I just want to end and thank you for your attention, and you're welcome to ask a few questions. We have a couple minutes. But please, Georgia has put a lot of time, money, and effort into years. We should be proud of what this state has done. We have a lot more to do, but great things are happening. And I want to thank you for all your support in that. As taxpayers, your money is going to that, and also invite you to help in any way you personally feel led to. Thank you.
Thank you, Lynn. We do have a few minutes for questions. I would just ask that if you have a question, would you raise your hand? We do not have microphones today. So just yell loudly. We'll try to repeat the question and say it back. So if you have a question, please raise your hand.
Walter. Okay. Mm-hmm.
Is there an estimate to what the cancer percentage would be if you took out the self-inflicted things such as the things that we ingest, with cigarettes and diet? How much of the population would get it just naturally? I know that's a tough question.
Can you reword that?
Yeah, if I can reword that. He's asking about, do we know how many cancers we would have if we had information that what we do to ourselves through smoking, through poor diets, through those, if that's away and we just knew how many maybe genetically or how many happen. I don't certainly have that information. I'm looking to Dr. Gabram as my medical person. She helps me with that, but I don't know that.
So adopting healthy lifestyle activities are very important. I would say if I had to take a guess, 20 to 30% less at least. We have seen that happen over the years. If people quit smoking, lung cancer rates have gone down. Exercising, very important. That can also impact breast cancer mortality. And again, healthy eating, watching your diet for colorectal cancer, ensuring more of a low-fat diet. All of these things can contribute. To give an exact number, that would be hard.
I don't think there are exact numbers, but yes, and we hear it all the time, healthy lifestyle, but it really does make a difference when it comes to cancer. It really does. There's one way in the back. Yep. Or go to that one. Thank you. Yeah, thank you. She's asking about the Cologuard and FIT test and colonoscopy, different areas. I'm asking Dr. Gabram to come up because she is the one leading. I had one quick slide on there about our CDC grant with colorectal cancer. So if you would give a quick thoughts on those three tests.
So there's many ways to screen for colon cancer. Certainly, colonoscopy has been the gold standard, and it was starting at 50, going to 75. That was recently changed down to 45. Colonoscopy is hard to get there. There's, not a lot of gastroenterologists around that we could just easily access, especially in some communities that don't have that resource. And so there's been work over time that has showed that if you get a FIT test, a annual stool-based test, again, starting at 45, that is equally as good as a colonoscopy every 10 years. Problem is you got to get it every year. In terms of a Cologuard, that's another gene-based kind of a test that you can also get. A little bit more expensive. Insurance does tend to cover it, and that's every 3 years. So you don't have to do that every year, but that is a little bit expensive. I can tell you last year I voted to get a Cologuard instead of going for my colonoscopy because, again, everything was shut down due to COVID. But good question, because what we're trying to do in that CDC grant is really push the FIT testing. FIT testing is very acceptable, and if you get a positive FIT, if there's blood found on that FIT, then you have to go for a colonoscopy.
Thank you very much. One last question, and then we're going to have to run. Yes, sir.
You mentioned the age of 75 as the top, but that's way in my rear view mirror. How about those of us who are way past that?
Yeah, it's up to your doctor. You need to talk to your doctor, and they need to decide what with you is best for you. It does let you explain. You explain it a little better than I do.
So for screening tests, in general, you want to, if you get a screening test, you want to make sure that it'll add years of life onto your life and not cause you to go through a bunch of tests that maybe you don't need. So for mammography, for example, we say keep going as long as you have an expected 10-year life expectancy. And that's why Lynn said talk to your doctor, because the general recommendations for United States Preventive Service Task Force about colorectal screening is from 45 to 75. If you have longevity in the family, it may be appropriate to have ongoing screening.
All right, we're running out of time, so I'm going to go. But thank you so much. We'll be here right after. You're welcome to ask questions. Thank you.
Lynn, just a moment. We just want to thank you again quickly. And I was sitting there thinking all that I learned, particularly about prevention, all of the different cancer trials. I had no idea 730 trials going on in our state. And the message I'm taking away is one of hope, that if we screen early and often, then survivor rates go way up. So thank you for that message. And also, in appreciation for you being here, we're going to place a children's book in our local library inscribed with your name.
Oh, thank you.
So thank you again. Just a quick reminder that today's program will be on Facebook, and also you'll get a YouTube link a little bit later in the week. And if you're watching online and you would like to attend next week, please let us know and we'll make sure to save you a seat. Last but not least, if you still need to get your directory photo, please see Jim in the back of the room after the meeting. We are getting very close to the directory deadline, and you don't want to be left out. So we re-welcome all of our wonderful guests and visitors. We're so glad to have you all here. We hope that you'll come back and see us again soon. And next week's program will be our very own Melody Trimble from St. Francis Hospital. So with no further business, we're adjourned.